One of the most common questions men ask is, how can I increase my semen volume? Today, we're breaking down everything you need to know about semen, how your body makes it, what happens when you ejaculate, why semen volume decreases, whether it actually matters to your partner, and finally, what you can do to increase it. Let's dive in. Semen is made up of a mix of fluids, not just sperm. In fact, sperm only make up about 5% of the total volume. That means having a smaller amount of semen doesn't necessarily mean your fertility is lower. Most of the volume actually comes from the seminal vesicles, about 60–70%. These are two small pouch-like structures behind the prostate that store fluid. Then about 20–30% comes from the prostate gland, which produces nutrients that help sperm move. And finally, a tiny amount comes from the bulbourethral glands right before ejaculation. Now, why does ejaculation sometimes feel powerful and other times like more of a dribble? That has to do with the bulbocavernosus muscles, which contract rhythmically to push semen out. The stronger those muscles are, the more forceful the ejaculation. But here's an important question. Does semen volume or force even matter to your partner? A 2018 study on 240 women found that the majority didn't care about the amount or force of ejaculate. Only 17% said their orgasm felt stronger if their partner's orgasm was powerful, and just 13% worried it meant they were less attractive if their partner's ejaculation seemed weak. The takeaway, in most relationships, as long as both partners are climaxing, volume and force aren't deal breakers. So, why does semen volume decrease? The peak is usually in your 30s, and after that it slowly declines with age. Factors like weaker pelvic muscles, poor diet, smoking, dehydration, medications, and health conditions all play a role. Even stress and hydration levels can affect semen day to day. A sudden and lasting drop, however, could mean something more serious, like a blockage in the ejaculatory ducts, low testosterone, or side effects from medications such as tamsulosin Flamax, which can cause retrograde ejaculation where semen goes into the bladder instead of out. In such cases, it's important to see a doctor. So, what can you actually do to boost semen volume? Here are 4 strategies. 1. Quit smoking. Smoking damages blood vessels and nerves, harms erections, and is linked to bladder cancer. It can also reduce the secretions that make up semen. Another reason to drop the habit. 2. Stay hydrated. Your body needs fluids to produce fluids. Check your urine. If it's pale yellow, you're well hydrated. 3. Strengthen your pelvic floor. Kegel exercises can improve the strength of the muscles that control ejaculation, helping you push out more semen forcefully. This doesn't create more semen, but it helps you release it more effectively. 4. Wait longer between ejaculations. This is the most reliable method. The longer the refill time, the more semen builds up. In one study, men who abstained for a few days saw about a 10% increase per day in semen volume. Up to 4 days gave the best boost, after which the benefit leveled off. So if you want more semen volume, focus on your lifestyle. Quit smoking, stay hydrated, exercise those pelvic muscles, and give your body time to refill the tank. And remember, most partners don't care about semen volume. It's far more important that you both enjoy intimacy. Take care of your health because you're worth it.